Hey there, I'm Dayna Johnson, dental practice management expert, certified Dentrix trainer, and founder of Navoni, revolutionizing the dental industry through innovation and strategic leadership. It wasn't long ago that I lived in your shoes, navigating the daily challenges of managing a dental practice with the hopes and dreams of having a productive schedule, money in the bank, and getting home on time to my sweet daughter. After 25 years working in the dental practice and 17 years as a certified Dentrix trainer, I found my life's work, helping dental teams one-on-one, optimizing their systems and software. If you are looking to create the thriving dental practice you have always dreamed of and empower your high-performing dental team, you are in the right place. Let's get started.
Hey, my friends. Well, now that we are out of September, which some of you call the month of September because your production is down so much and your doctor's appointment book is empty and you're not getting patients to say yes to treatment and your schedule is empty and you're like, phew, now though, thank goodness we're out of September, because that's always the suckiest month of the year. So many of you say that. I kind of think it's a myth. I think that sometimes it's an excuse to just say, hey, my appointment book's empty, so I'm just going to blame it on September. Well, now that we're out of September, we're now in October, which could be a beautiful month for production. I want to talk about how we can boost your schedule, your production, and reach out to patients with unused dental benefits, because now is the time. I usually would start this, in the last quarter of the month or last quarter of the year. So October is the perfect time to start reaching out to patients that have unscheduled treatment and unused insurance benefits, because, the fact is that if the patient doesn't use their benefits by the end of the year, then they don't roll over into the next year. The patient needs to use those unused insurance benefits. So now's a great time to do that. We want to, if you've been listening to me for a while, you do know that I am always reaching out to patients that have unscheduled treatment using the treatment manager report. That is part of my weekly training. If you work with me on a regular basis, if you're part of our membership, or if you are one of my coaching clients, you know that I teach your teams to reach out to patients that have unscheduled treatment on a weekly basis. It's just part of my routine. And so we never want to let up the gas on that process. It should be part of your weekly routine, no matter what month it is, whether it's April or July, or now that we're in October. So we always want to be reaching out to patients that have unscheduled treatment. It's just part of running a dental practice. But in the fourth quarter of the year, we do find that many patients, their insurance benefits are going to end at the end of the year. That's just the most common end of dental benefit year. Is most insurance plans are going to renew in January. Now, not all of them, so you could definitely take this podcast and listen to it in the month of April if you have plans that renew April 1st. I know I'm from the state of Washington, and a lot of our dental plans with the Boeing group, they renewed in July. Most of our school districts renewed in September. So, it's not every plan renews in January. It's just most of them do. So this is always a good time to get in the habit of running your reports, and you can filter them based on unused insurance benefits. You also could start planning some campaigns with your patient engagement software. So let's talk about what you can do inside of your practice management software first. So Inside of your Dentrix software, all of you, if you've been listening to me for a while, you know how much I love the treatment manager report. So the treatment manager report is the best report for finding patients with unscheduled treatment. And there is a feature inside of that report where you can filter by unused insurance benefits. So you could filter that report by a specific dental plan. If you do know that you have specific plans that do renew in January, you could filter it by a specific insurance plan. You could just filter it by a specific dollar amount. So if you could say, show me a list of all my patients that have unscheduled treatment and they still have at least $500 of insurance benefits available. And then, poof, Dentrix spits out a report for you so your team can reach out to these patients and try and get them scheduled. And it's always a good idea to let patients know that their benefits that they still have remaining do not roll over into the next year. Patients don't know anything about their insurance. All they know is that, they should get 2 free cleanings a year and, an exam. And other than that, they really don't understand their benefits. So it's up to us to educate our patients about what's going on with their plan. I know that you don't want to babysit your patients about their dental insurance. I don't want to do that either. But as a healthcare provider, and if you do want to provide that value-added service to let your patients know what's going on with their plan and help them understand their benefits better, then it's up to you to let your patients know, hey, Dayna, we're getting towards the end of the year. I know we've talked about that crown in the lower left. We've talked to you about it a couple times. I understand that. I just want to let you know that as of today, you still have $643 available on your dental benefits. If you don't schedule that crown by the end of the year, that $643 does go to waste. So I just wanted to give you the heads up in case you were thinking about scheduling. We would want to get you scheduled before the end of the year so you don't lose out on that $643 that you still have available. So it's up to us to have that conversation with our patients because they just don't know. Patients do not keep track of how much dental benefits they have available. They just don't do it. I mean, nobody has a Excel spreadsheet where they're keeping track of all of their benefits that they've used. Patients just don't do that. They expect us to do it. And if we don't do it for them, they're not going to call their insurance company. And I can guarantee you their HR department at their employer is not going to do it for them either. So if you want to just add a little bit of value added service to your dental practice, I would encourage you to run this report and find out the patients that have unused insurance benefits. Okay, when we come back, we'll talk about email campaigns.
Did you know that you could increase your team's productivity by up to 200% if you had a formal team training program in place? And businesses that do have a formal team training program in place also enjoy up to a 24% increase in profit margin. If you want to learn how and book a call with me, click on the show notes and book a free discovery call with me, and we will talk all about it.
All right, welcome back. Okay, so the other thing that you can do this time of year is maybe schedule an email campaign with your patient engagement software. So depending on who you're using for patients, like texting, emails, electronic forms, online booking, whatever you might be using as your patient engagement software, you should be able to generate a campaign where you are sending out a mass email or text, and your patient engagement software should be able to generate a list of patients that it would send out to that have unscheduled treatment. Now, you will have to find out if your patient engagement software can filter it by unused insurance benefits. That might be on you to reach out to your software provider. If you're using Dental Intel Patient Engagement or Patient Engage or, Solution Reach or Weave or RecallMax, whoever you're using for your patient engagement, you might need to reach out to them and say, hey, I listened to this podcast from Dayna, and she says that I should be able to send out a campaign to my patients that have unscheduled treatment. And hey, by the way, can we also filter it by patients that have unused insurance benefits? So your patient engagement software should be able to do that. And so you might want to send something out. I would recommend that it's not too glitzy. It's not too salesy. It's, anytime I do an email campaign to my prospective clients or a prospect, I always try and write those kinds of emails in plain text. So it doesn't have a lot of pictures. It doesn't have a lot of flashiness to it, because if it does have a lot of flashiness to it, patients were probably going to delete it. So, or mark it as spam, and we don't want that to happen. So I always write my emails, if it is some kind of a sales email, which when you're trying to get patients to schedule unscheduled treatment, it is a form of sales. And so anytime you're trying to sell to someone, I always recommend that you talk to them as if you were talking to them in the office. So use language that is like you're having a conversation with your patient, like over the front desk counter. It'd be something like exactly what I just said in the conversation before. I would say something like, hey, Dayna, this is Saratoga Dental. I know that we have talked to you about your unscheduled treatment in the past. I'm just sending you a courtesy, letting you know that we're getting towards the end of the year and you do have unused insurance benefits. And I just want to let you know that if you don't use those insurance benefits by the end of the year, they don't roll over. You will lose out on that unused insurance benefit. And so I just want to give you a courtesy email just to let you know that. Now, if you're ready to schedule that treatment, please click on the button here if you have an online booking tool, or it might just say, please give us a call, or please text us at this number, however you want your patients to reach out to you. I love online booking, but I'm not a huge fan of online booking for treatment. Because you do have to have that financial conversation with the patient. You don't just want a crown dropping on your appointment book and then have the patient come in and not know what their out-of-pocket is. So you may have something for maybe text here if you're ready to schedule. I've also heard that there are some softwares that can have a link direct to trying to get approved for care credit. So if the patient wants to get approved for care credit prior to scheduling, I have heard that there are softwares out there. I'm not sure exactly which ones they are, so you may want to inquire about that. And so you could just let the patient know you have unscheduled treatment. You also have unused insurance benefits. And we would like to get you scheduled before the end of the year so you don't lose out on that benefit. If you would like to apply for care credit for your out-of-pocket expenses, here's the link or here's a button to click on. So you can create this email campaign that would kind of check all the boxes and let the patient know that they're going to lose out on those benefits. They do have unused insurance. They do have unscheduled treatment. And here's a place where you could apply for credit if you needed it. So I would recommend doing both of those two things. The treatment manager, filtering it by patients with unscheduled treatment and unused insurance benefits. That gives you a call list. Then you can either text those patients or, send them an email or however you want to reach out to them. Traditional phone calls still work these days. And then also creating a campaign. So those are my suggestions. I think it's a worthwhile benefit to your schedule to reach out to patients. So I hope these suggestions were helpful. And if you want to dive into these topics in a deeper way, we're always available. We do have online courses available. So if you do want to dive in a little bit deeper, we would be happy to have you. You can book a call with me. We can get on the phone together and just talk about your practice. Maybe it would be a fit. Maybe it wouldn't. Also, if you liked this episode, please rate it, review it, share it with your colleagues. We appreciate getting our information out to as many dental practices as possible. So I hope you have a great rest of your day, and I look forward to watching your journey of becoming a high-performing dental team.